Hello, my name is Mira Bihari, and I am an adolescent medicine specialist. If you joined in on the previous episode, you know that means that I trained as a pediatrician and also did some specialty training in adolescent medicine. If you'd like all the details on that, go back, check out the first episode where I talk about how one becomes an adolescent medicine specialist. Today, I'm going to talk a little bit about why one might become an adolescent medicine specialist. So, everybody who is an adolescent medicine specialist has their own journey, their own reason for why we chose this field. I will share a little bit about my experience and why I chose to do this work. For me, when I came of age, it was the 80s and a time where there was a lot going on in the world. HIV pandemic was going on, and we at first didn't know how that was being transmitted to people. There was a lot of fear and a lot of misinformation, just lack of information, kind of like what we had in the early days of the COVID pandemic. As we figured out a little bit more about what causes HIV and how it's transmitted, people became very fearful of being exposed to other people's body fluids. But teenagers being teenagers, intimate relationships still happened. And the particular high school that I went to, unfortunately, had some young people who found out that they were HIV positive when they went to donate blood. The school I went to also had some significant problems with teen pregnancy, but the school administration at the time was not permitted to allow students to receive condoms from the school. And this is something that is still a challenge in many school districts to this day. We know how to prevent problems, but we can't have, for a variety of reasons, the schools aren't able to give out some of the tools. And sometimes in some places, some health clinics aren't able to give the tools to help the young people advocate for themselves and make healthy decisions for themselves. So that inspired me to want to do something to help prevent those problems. There were also lots of issues with violence in general and gang violence. Also, just some issues with drug use and safety. It was a pretty scary time to be a young person. But like all young people, there is also hope for the future. So those were some of the things for me that drove me to become an adolescent medicine doc and help the young people while they are still young. As I went to medical school, I vividly remember during my internal medicine rotation, I was debating because, like we talked about in the first episode, do I do peds? Do I do family medicine? Do I do internal medicine? I knew I wanted to do this adolescent medicine thing, but I didn't know which residency I wanted to do. And for me, as I was doing my internal medicine rotation, one of the things that we would do is we would ask people who were smoking or who had chronic obstructive pulmonary disease. One of the consequences of long-term smoking, we would ask them, when did you start smoking? And invariably, the people would say, these are folks in their like 60s, 70s, would say, oh, when I was 13, 14, things like that. And I thought, gosh, we're spending all of this time and energy trying to help keep this person alive and healthy now. And it would have been a heck of a lot easier to prevent a lot of that. For folks who are younger, you probably don't remember, but I was actually recently reminded of this by a conversation with a patient who couldn't believe that, at one point in time, smoking was allowed on planes. And, further blew that patient's mind when I told them about the fact that at one point doctors were recommending smoking and people could smoke in the hospitals. There were smoking zones, no smoking zones, bars, clubs, everywhere in restaurants, even in our country, there was smoking all over the place. So we've made some strides in terms of preventing and doing that work. But the fact still remains that behaviors that begin in adolescence shape one's life later on. So healthy habits that are picked up, whether that's how we're moving, how we're eating, how we're dealing with our mental health issues, all of these behaviors affect how we deal with life as we move to adulthood and then further on in maturity to our senior years. So for me, that was kind of the thing that I was like, yes, this is what I want to do. I want to work with young people and I want to prevent some of these long-term complications. And I think all of us in adolescent medicine, we think about the young person who's right in front of us, right in this moment. And then we think about what that person's going to be when they're like 25, 30, 40, 50, 60, 70, 80. We think about the long-term consequences. So we're thinking about their health now, but also the later on periods, in part because for a lot of young people, as we know, their brains are still growing and developing at least until age 25. So their prefrontal cortex, the part that makes decisions like, hey, this is a good idea. Hey, this is a bad idea. Hey, I really want to do this and get this instant reward. That part of the brain is still developing. And we, as the adults in the young people's lives really should be that person who can help guide the decision making so that they choose things that will hopefully help them be healthier for a longer term. So that's kind of the why of why most of us in adolescent medicine choose this field. Many of us go on to do research or teach. That is part of why we choose to do this 2 to 3 year fellowship, depending on which discipline we chose. And I think we also enjoy the direct clinical care. If we just wanted to do research and just wanted to, teach, there were other ways that we could do that. But we really do enjoy seeing the young person as a whole person. Whenever I talk about adolescent medicine, I talk about the biopsychosocial approach. This is a way of looking at health that came to be developed in the 70s by George Engel. And it's something that I was taught very early on in my medical education at the Sophie Davis School of Biomedical Education, now CUNY Med. And the idea is that our biology, our psychology, and our social situation influences our health as well as our disease. This is very true in adolescence. What I tell folks is that the top 3 things that kill adolescents in our country haven't really changed since I was an adolescent. It is accidents, usually motor vehicle accidents, suicide, and homicide. And depending on what's going on in our world and which part of the country you're in, sometimes homicide's a little higher than suicide, vice versa. But in general, those top 3 things have been the top 3 for a long time. And I could listen to a teen's heart and lungs all day, all night, and it's not going to tell me if they're at higher risk of accidents, homicide, or suicide. But that psychosocial interview, that discussion with the young person and really getting the detailed information from them directly is what helps us figure that out. And I have worked in a variety of settings. I have worked in free clinics. I have worked in busy primary care settings. I have worked in private practice. I have worked in academic settings. And I know the challenges in all of these different areas when you're trying to get that history, but also trying to stay on schedule and do everything that you need to do. It is not easy, but it really is rewarding when you get that information and you can help change the course of a young person's life. So part of what I do in adolescent medicine consulting is help folks learn how to do some of that in whatever your practice might be, whether if it's an FQHC or private practice, whether you're in an academic setting, whatever it might be. I can help you figure out a little bit more on how we can get some of that information and really use your time efficiently when you're with a young person and build on that to help prevent some of these unhealthy outcomes and really mortality. So that's the mortality part. I didn't even get into the morbidity part. We know that young people get into high-risk behaviors, smoking, drinking, drugs, sex, all of these things. And we, as adolescent medicine folks, certainly believe in preventing risk as much as possible and reducing risk whenever we can't fully prevent that risk. So those are all things that there's a variety of screening tools. There's a variety of different questioning techniques and things that you can do in your practice to help you get this information and help the teens have a healthier long-term life. And as we move into future episodes, we'll talk more about the screening tools that are recommended, some of them from the AAP now, and what we can do when we get a positive screener in that moment. And when you've got a positive screener, but you've got like a 6-month wait list before somebody can get into a therapist in your area. What are some of the things that you can do in your practice to help that young person in the moment? So the why. Why do we do adolescent medicine? Because we care about the young person now in the moment. that they are a teenager, and also in their future when they're 20, 30, 40, 50, when they've got teens of their own, when they've got grandkids of their own. So we really do care about the now and the future. That's adolescent medicine. And this is Mira B. Harry with Adolescent Medicine Consulting, giving you little bits of information about adolescent medicine and how you can help the teens in your practice. If you'd like more information, please check out our website and or give us a call. Website, adolescentmedicineconsulting.com, phone number 254-718-7559. Definitely want you to reach out to us so we can help you help the teens in your practice. Take care. Until next time. Bye.